Hello everyone, welcome back to Made Easy Nursing. We are here with the last sessions of Anatomy of Female Reproductive System, that is part 6, and we will discuss the last part of internal genital organs. So before going to today's sessions, we will briefly recall about the previous sessions what we have discussed so far. So in part 1 of our anatomy of female reproductive system, we have categorized the whole female reproductive system into 3 parts, that is external genital tract or organ, internal genital tract or organ, and accessory organ, that is breast. And along with that, we have discussed in detail in part 1 regarding the external genital organ whole, and we enlisted mons pubis, labia majora, labia minora, clitoris, vestibule, and the 6 opening of this vestibule like urethral opening, paraurethral glands, introitus, and bulbourethral gland. From the part 2 onwards, we proceed in this internal genital organs, and there in part 2 we have leveled all the internal genital organs like your ovary, fallopian tube, uterus, cervix, and the vagina. In part 2 we have discussed in details regarding the detail about this ovary, its location, size, shape, weight, the parts of this ovary like outer cortex and inner medulla, functions of this ovary, ligaments attached in the ovaries for its supports, and the clinical relevance like the ovarian cyst, PCOS, and the ovarian cancer. Then we proceed to the part 3 where we have discussed in detail the fallopian tubes, its lined by cilia, its functions, the unique cells like peg cells, okay, and the different part of the fallopian tube like interstitium, isthmus, ampulla, infundibulum, their unique features, length, breadth, etc., and the clinical concept like salpingitis, salpingectomy, salpingo-oophorectomy. Then we move to part 4 where we have discussed in details about the uterus, the normal locations of the uterus like antevertate and anteflexed, what is that meaning. Then the part of the uterus like the fundus, cornua, body of the uterus, isthmus, everything in detail, and the living ligature, what is the concept of this living ligature, and the different parts of the uterus we have discussed in details, the blood supply of the uterus and the clinical concept, hysterectomy, its types, etc. Then we proceed to the part 5 where we have discussed in details the cervix, okay, and the length, breadth, what is the difference or basic concept between this internal os and external os. Then the parts of the cervix like endocervix, exocervix, then what is transformation zone, and the investigation choice, if the mother or female will be having CA cervix, how will you diagnose, and then up to this much we have discussed. Now our today's topic of discussions will be the last part of this internal genital organ, and most probably we will finish with this anatomy of female reproductive systems, and here is your part 6 where we will discuss in details about the vagina. So what is vagina? Vagina is a fibromuscular tube, okay, it is a fibromuscular tube, or you can say it is a hollow organ, okay, hollow organs. And now you have to specify from where to which region this vagina is located. See, in the previous sections we have discussed in details, this is a canal, we can say it as cervix, okay. Here is your, in these portions we will say is as endocervix, and here in this location it is called exocervix. And from here in these portions vagina started. So if I say from which location till which locations this vagina is located, then we can say this vagina is connected from cervix to external genital organ, okay. Why I kept this picture here, because this vagina, it is inside portions, right? You can't visualize it from outside. So this vagina from here it started till this is the outside portions, right? So it is the external genital organ. So vagina started from this region from this region till the external genital organs, which you can visualize from outside. Or else you can say in other words like this hollow organ, that means vagina, it connects uterus to your vulva. Vulva means the same. This portions, this region only we are saying, this whole pinkish region we are saying it is as vulva, right? So from here, this uterus, from here till this vulva region, this vagina is connecting like a channel. Okay, so that's all about this concept of vagina. Now coming to this location, again the same thing. This location means this vagina extend from your cervix of uterus to your vaginal orifice. Okay, vaginal orifice means the introitus. So here this region is called your uterus, this is the cervix, and this is the vagina. Okay, so it extends from cervix till the outside region, that is your vaginal orifice. Okay, that's all about the location. Now coming to the lining of vagina, just remember this vagina is lined by non-keratinized stratified squamous epithelium. Just remember, okay, non-keratinized stratified squamous epithelium. Now coming to the relations, how will you say this anterior portion, from anteriorly vagina is located with, posteriorly vagina is located with, or laterally vagina is located with which parts? So for making a border, you need to specifically tell about the relations of vagina with other organs. So I will draw one picture like this. Here is your let's think this is the abdomen of a woman, abdomen. Okay, now means this is the lower border of this abdomen, and here is your bladder, urinary bladder. Okay, here in this it is urinary bladder. Then coming to your uterus. Okay, it is uterus, and this is the vagina. Okay, then coming to these portions, behind this uterus your rectum is located, this is your rectum. Okay, and this whole thing, this is the peritoneal seat. Okay, this from upside border also, this peritoneum seat, this is the peritoneum seat. Okay, covered this all organ. Now here it is a major clinical concept is present here. You need to understand this is the peritoneum. In these portions we will call it here one name is there, and this portions also something name is there. This portion specifically we will call it as pouch of Douglas, and it is having a clinical significance that we will discuss in later. This is pouch of Douglas, or else we can say it is recto-uterine pouch. And these portions we will call it as uterovesical pouch. Okay, now we will tell in details. So anteriorly, what we will say, anteriorly vagina is located with your bladder and urethra. Okay, this is anterior portion, this is your posterior portion, right? So anteriorly first this urinary bladder will come, urinary bladder along with urethra. Now posteriorly, as you can see, posteriorly this rectum will come, rectum along with recto-uterine pouch, uterine pouch will come. This vagina is located posteriorly with this portion, pouch of Douglas or recto-uterine pouch or rectum, and laterally it is levator ani muscle. Okay, levator ani muscle is one of the muscles of the your peritoneal portions. Okay, so anteriorly vagina is covered or situated with bladder and urethra. Posteriorly it is covered by rectum or rectouterine pouch, and laterally it is covered with levator ani muscle. Now there is one significance of this rectouterine pouch or pouch of Douglas. So what is that pouch of Douglas or rectouterine pouch? So rectouterine pouch means it is between the rectum and uterus. Uterovesical pouch means between uterus and your vagina. Okay. Now, what is the meaning of this pouch of Douglas? What is the significance of this pouch of Douglas or rectouterine pouch? As you know, there is one concept or there is one clinical concept of ectopic pregnancy or pelvic inflammatory disease. Okay, so if a mother will suffer with pelvic inflammatory disease, then there will be fluid accumulation in these portions. Or if the mother is suffered with this ectopic pregnancy, and if it is a ruptured ectopic pregnancy, then blood will collect in this region. So this region is having very important clinical significance. So if the mother is suffering with a PID, pelvic inflammatory disease, okay, then fluid will accumulate. Fluid will accumulate in this region, okay. If the mother is suffering with ectopic pregnancy and specifically ruptured ectopic pregnancy, then blood will accumulate in this region. So how will you diagnose whether it is a case of pelvic inflammatory disease or it is a ectopic pregnancy? Then these doctors are doing, they are inserting one syringe, okay, from this region, means from posterior fornix, okay. They will insert one syringe, they will insert syringe through posterior fornix. I will tell you what is fornix, what is the concept of this posterior fornix. So they will insert one syringe through this posterior fornix into pouch of Douglas, okay. And if they find blood, then they will diagnose it as ectopic pregnancy. If they find any abnormal fluid, they will diagnose it as PID, pelvic inflammatory disease. So that is the concept of this pouch of Douglas, okay, and its clinical importance. So what is pouch of Douglas or rectouterine pouch? It is the portions between the uterus and your rectum. So it is having clinical importance, like where if the mother is suffering with pelvic inflammatory disease, then fluid will accumulate in this region. If the mother is suffering with ruptured ectopic pregnancy, blood will accumulate in this region. And then healthcare workers insert syringe through this posterior fornix into pouch of Douglas, okay. Then if they find blood, they will diagnose it as ectopic pregnancy, or we can say this is a case of accidental hemorrhage something. And if they find any abnormal fluid, they will diagnose it as pelvic inflammatory disease. So that is the whole concept of pouch of Douglas. Now coming to the functions. What is the functions of vagina? So vagina is like a pathway through which penis enters into vagina, into the internal organs. Most specifically we will say penis enters into the during intercourse, okay. Penis enters during intercourse. So it is the pathway through which penis enters during intercourse, okay. And also it's the path or outlet through which menstrual blood comes out, and also this is called birth canal, through which baby will come out. Okay, now coming to the opening. Here you will understand the parts of this fornix. So the upper end of the vagina, upper end and lower end. So as you know, this lower end is opens, this vagina is opens here, okay, in this portion. So lower end, here this vagina extend into the lower region towards the vulva, okay, vulva or vestibule. And upper end in this region, this is the upper end of vagina. Here upper end, it is the surrounded by cervix, okay. So your opening, that is opening of vagina, upper end surrounds by cervix, and lower ends opens into vestibule of vulva, okay. Now if you do a cross section, this is your uterus, okay, and here it is extend vagina, like here in this cross section. If you do a cross sections, you can see it, this vagina's cross section, it is like a H shape, and there is 4 pockets in this H shape region, okay. Sorry, this upper ends of the cervix, here you will see the fornices, okay. Fornix means singular and fornices means plurals. Fornices or pockets you can see, okay. And this is the anterior pocket, this is the 2 lateral pocket, and this is the posterior pocket. From here you just need to remember this posterior pockets is the deepest one and it is the shallowest one. So from this fornices you just need to remember total 4 fornices are there, 1 anterior, 2 lateral pockets and 1 posterior pockets, and the posterior pockets is the deepest, the posterior fornices is the deepest one and the anterior fornices is the shallowest one. So this all about this fornices, 1 anterior fornix, 1 in number, lateral fornix, 2 in number, and this posterior fornix, that is also 1 in number, and this is the shallow one and this is the deepest one, okay. Coming to the vaginal flora, this vaginal flora actually acidic in nature. This is pH is about 4 to almost like 4.5. This is acidic in nature. Why? Because in this vaginal flora there is one local inhabitant bacteria present. What is that bacteria's name? This bacteria's name is Lactobacillus acidophilus. This is making acid, and more specifically we will say it Dodelin bacteria, okay. What this bacteria is doing, it inhibits local infections. How it will inhibit the local infection? In the vaginal wall glycogen is present, okay. What this Dodeline bacteria is doing, it converts this glycogen into lactic acid, and that is why it is making the acid, and this acid making this vaginal flora acidic, pH almost 4.5, okay. When this Lactobacillus acidophilus, that means Dodeline bacteria appears, it appears during your at the time of puberty, okay. So, and when it disappears after the menopause. So your throughout reproductive phase, okay, throughout this reproductive phase, your vaginal region, reproductive age, it is acidic in nature. Once the woman gets menopause, and after this menopause, as the Dodeline bacteria disappear, the vaginal flora will become basic in nature. And throughout your reproductive age, this will be acidic in nature except the menstrual phases. Every month the woman is going through this menstrual cycle. When the menstrual blood flow remains for 4 to 5 days, at that time it will be slightly alkaline in nature, as because of the blood presence, and remaining all the time it will be acidic in nature. Now the last part is clinical importance. What is the clinical importance of this vagina? Okay, now you have to remember about this hymen. As you know, there is one small membranous sheath present, membranous tissue present at vaginal orifice. Okay, it covers the vagina canal, and through this hymen there is small hole is there through which slide, for in case of young woman. Okay, young woman, this hymen will be having partial hole through which this menstrual blood is coming. Okay, menstrual blood comes out. Now if, let's think, in some women this hymen will not having any partial hole through which this blood will come out, what will I say for those cases? It will call imperforate hymen. What is this imperforate hymen? When there will be no opening. Okay, no opening in hymen or membranous sheath, then we will call it as imperforate hymen, and we will say it as cryptomenorrhea. Cryptomenorrhea means concealed menses. What is that meaning? That means menstrual blood will not come out, as because there is no opening in hymen. No opening in hymen. Okay, so that is one clinical importance. Then another thing you need to remember about the vaginitis. Vaginitis means if there is itis, means there is inflammation of vagina. Due to any kind of infection, there will be infection, and then it will call it as vaginitis. Another one important clinical concept, like your rectocele and your cystocele. Okay, rectocele or cystocele means there is prolapse of vagina due to weakness of vaginal walls. Okay, so that's all about this your vagina portions, and we have completed with the whole anatomy of female reproductive system in total part 6. I will take another sessions where I will be making some important notes regarding the different internal organs with their surface lined by which kind of cells, like whether it is stratified or squamous or columnar, keratinized, non-keratinized, then the blood supply of different external and internal genital organs. And I also told in the first chapters, like first sessions, I will be discussing the female reproductive organs with comparison with the male reproductive organs due to their homologous in nature. So I will make some charts regarding this, and then we will complete it with this anatomy of whole female reproductive system. Then we will jump into the menstrual disorder, menstrual cycles, pregnancy, and etc. So thank you, dear students. Keep your preparation in